Hi guys, welcome back to the skill of the week. This week we are talking about the peds crash cart and just some of the things that go along with pediatric resuscitation. So we're just gonna quickly go through kind of what's in the pediatric crash cart. We're gonna talk about drawing up pediatric meds. We'll also talk about push-pull fluid administration. So we'll go ahead and get started. So the crash cart is there are three different types of drawers. We have the top drawer, which they're calling the medication drawer. There's also some supplies in there. The bottom drawer, which has some general supplies in it, and then the colored drawers, which are divvied up by patient weight. I really hope all of you know how to use the Braslo tape. You should all know how to use the Braslo tape. So once you figure out where your kid falls on the Braslo, pick your color, and that's the only drawer, the only color drawer that you need to open. It should have everything size specific for your pediatric patient in it. But you will need the top and the bottom drawer as well. So this top drawer, the medication drawer, we have the actual med box itself. It's very similar to our RSI kit. It has the locks and everything on it. So this needs to be replenished by pharmacy. So you need to let them know if you get into the pediatric med so that they can replace all of this. It does have the list of the medications and their expiration dates in here. So, and under there where you can't really see it, it has the actual expiration date for the entire kit. There's an extra Braslo in here just in case you can't find that one. Other things that are in the top drawer that you need to really be aware of. Your blades and your handle for intubation are in here. They're Max and Miller's and your handle. Your connectors to draw up pediatric meds are in here. There are some 3 ways to do push-pull fluid administration. Everything else is general supplies, ABGs, trach ties, a few other basic supplies. So just want to talk real quick about pediatric medications. Advocate Aurora did come out with a new book to replace our old drug resuscitation book. Let me find the front of this. There it is. So these just came out. There is one on top of the crash cart. The old one is still here. This one is very user-friendly. Really seems to work well. So you open it up to a page. So if this is a 5 kilogram patient, all of your drugs are in here. The thing that's really nice about this has medications for things other than just resuscitation in it. So use it as a resource. You know, it has hypoglycemia, anaphylaxis, seizures. So if you have a kid, you don't need to crack the crash cart, but you're drawing up meds for a pediatric patient, you can get all of your dosing based on your weight right in here. All of your resuscitation, RSI meds, reversal agents, it's all in here, easy to use. So if you are cracking into this medication drawer and you're looking up your meds, a lot of the volumes are going to be very, very specific because pediatric patients obviously are all different weights and we have to dose them very specifically. So we have these fluid connectors. They are in the drawer here. There are a couple of them in here. If there aren't any in here, there are more in the storage room in the back. They're way up towards the top. You have to find somebody tall to get them. You take off just the little caps. It's just a 2-sided female connector. Doesn't matter which side you put it on. So if pretend that this is epi, and we don't need to give this whole thing of epi. It's not safe for you to say, oh, I'm just gonna give half of this and push it in. So what you need to do is actually draw up half of this into another syringe. So this is the easy way to do it. So you can connect it on either side. I usually like to go this way. And then you can put your empty syringe over here. Flip it upside down and you can just draw meds straight out of your syringe. If you draw it this way, you'll end up drawing the air out of there and it's hard to get it back out. If you do it this way, any air that you push back in, it just ends up back at the top of your syringe. So you can easily go back and forth to draw up an exact amount. That way you're not putting your kid at risk. You're drawing up the exact amount of medication that you need. So these are wonderful. You can also use these, again, you don't need to be in a code situation. These are great for drawing up meds. All right, so that's the medication drawer. Then we have this bottom drawer that has a lot of just general equipment. All of the infant and peds blood pressure cuffs are in here, along with the cables that you need to operate them. There's also a warmer in here, which we'll demonstrate in a couple of minutes. There's an IO, so you don't need to go grab one out of the trauma lockers or out of the med room. There is one in here that has pediatric and adult sizes in it. Internal defibrillator pads, and then all of your central line stuff is in here as well. So all of the drawers are the same with just a very few exceptions. So we'll just go ahead and crack this one open. Everything is divided into bags to try and make it a little bit easier on you for when you're looking for things. So again, same supplies in every drawer, just different sizes based on your patient. So bag 1 is all of your like nasal cannula, masks for oxygen, that type of oxygen supplies. Bag 2 is all your IV supplies. So there are IV supplies in every single drawer. Bag 3, oral airways. Bag 4 is like your intubation stuff. There are also nasal airways in there. Bag 5 is stuff for like NG, OG. I think there's nasal suction and everything like that in here as well. And bag 6 has Foley's and chest tubes. So the only thing that's unique, so for some of our younger patient, you know, infants, newborns, things like that, in this bag 5 for this, there is a meconium aspirator. That's one thing. If somebody's asking for that, it is located in the crash cart. So just something else to be aware of there. Let's see. So there's a warmer, an infant warmer on the bottom. There's usually an extra one on top too. So I'm just going to show you how to use this real quick. Again, it doesn't have to be for resuscitation. These are really nice, especially if you have like a kid that you're trying to warm up. So this is literally just a big heat pack. There's a little black disc in there. What you do is you grab the disc, bend it, and it activates the warmer. This side is a little bit softer. Always make sure that you're putting them on this softer side. This is just like a plastic, they'll stick to it. But you can literally put an infant straight on here to warm them up and kind of nest them in there. So those are very nice to use. Other things that we can talk about with this. So if you're needing to give your kid a push-pull fluid bolus, they have gone ahead and made an actual kit for push-pull fluid boluses. It's really nice because everything is in here. You can just grab this. If you need to go to a different room, you don't need to bring the whole crash cart. But this is the best way to get fluids into a kid and get them into them quickly. So things that are in here, it's just very basic supplies, but it's nice to have it all in one place. There's a bag of saline, syringes, and some stopcocks. So how you do a push-pull fluid bolus. All you need is a stopcock and a syringe, and then just your normal IV tubing and setup. So you got your stopcock. So we take off all these little caps. So there's really only one way that you can hook this up. So there are 2 female ends and a male end. Obviously, you need the male end to connect to your patient. So you can put that on like this. So then you're just left with a couple of female ends. So we will hook our tubing into one of these. Oh, this one doesn't want to stay on. There we go. Hook our tubing into one of the female ends. So really all you're doing is just adding another piece in the line here. You can leave these in here. You don't have to take it off after you're done giving a fluid bolus. Just run the saline like you normally would. You can hook your syringe up here. And the way you do this, so you're going to turn the stopcock off to the patient. Let me unclamp all my stuff here. So say for your kid's weight, you need to give a 30 cc bolus. What you can do, so this is a 10 cc syringe. I will draw up 10 cc's. So I've got 10 cc's in here now. switch this to turn it off to the bag, and then I can just go ahead and push it into my patient. So you can give a rapid fluid bolus that way. Turn it back off to the patient. I can draw more up and quickly push it into the patient. There are different size syringes in the bag, so you really need to be sure that you're keeping track very carefully of how much fluid you're giving. So if you're gonna give a 30 cc bolus, you can just grab a 30 cc syringe, and that'll save you. You can do obviously 310s, whatever you need to do. Some people like marking on the bed, especially if you're in an emergency situation, just so that you don't lose count and, you know, have an oh crap, how much fluid have I given moment. Also, if you see somebody doing a push-pull and they're doing like multiple, try not to interrupt them because they are trying to keep track of how much fluid they're giving. So that is that. Other things to take note of on the peds crash cart is how we restock it. So it's our responsibility as the primary nurse or the flow to restock this when we use it. So up in the nursing documents folder, right up by the secretary, is where we keep the stickers for the bags. It is under Broslow bag stickers. So there is an actual laminated sheet in here that shows you how to print more stickers if there are none in the folder, or you can always reach out to Jen Hughes and she's able to print more stickers. So these are all color coded and everything like that. So you just put everything into a bag and then label the bag. If it's, you know, bag 1 from the yellow, obviously put that sticker on it. I know a lot of people search high and low for these, so make sure you know where they are. And then the locks for the crash cart are located in the Pyxis. A lot of times they're over on the RME side. There's a good stash of them there. You can pull them under floor stock. They are under locks. So when you put a lock on this, what you are saying is, I have verified that everything in here is exactly how it should be, and this is your seal of approval. So don't put a lock on it if you're missing something, if you know you're not sure, because if somebody comes to this and sees all these locks on it, they're assuming that every single thing is in this cart that they might need. So that's just kind of a general rundown of the pediatric crash cart. I would encourage you to try and do a push-pull fluid bolus this week, and also practice drawing up some pediatric medications, just so you're comfortable with those connectors and pieces. Let me know if you have any questions. Otherwise, we'll see you next week.